So the FDA's missions are broad. It's really important to realize that the FDA is in charge of drugs, so biologic drugs, small molecule drugs, but also food, tobacco, public health of many types, some mobile applications, cosmetic products, things sold in the drugstore, advertising of products sold to consumers related to health. It has a very broad mandate. But really, it's a public health agency designed to promote the public health. And when you meet with people at the FDA, it doesn't take long before you sort of scratch the surface to, well, why are they there? It's almost always a public health, wanting to help Americans live better. It's sort of what drives into work in a complicated place to work, what probably has a lower salary and more complexity than most places that you could choose to work. Second is, and this is part of the law, is that their job is to speed innovations into the market. So a lot of people go, my God, a regulator, they must be there to slow down and add caution and complexity. That would be wrong. The FDA actually is required to design policies that it brings innovation to the market. The FDA prides itself actually on the fact that it's improved in most regards, whether it's timelines and how quickly things get through the process over the past 10 years. I think there's a healthy competition between the FDA and the EU regulators and others about sort of who's faster and who's more predictable. And the FDA, particularly in the area of health IT and mobile health, views it as a burgeoning area of tremendous potential, and I think wants nothing more than to help enable innovation, not sort of slow it down. Congress can do oversight to make sure, by the way, that the FDA is, quote, speeding innovation. So this is a really important aspect. And the FDA, as a result, has a bunch of timelines in the law for how fast they have to respond to your letter and go through an application. And most of the time they hit those or exceed them. So we can all talk about sort of the exceptions. But broadly speaking, the FDA is predictable, transparent in terms of how it works, and responsive. And so I want to kind of start you with that because I think a lot of people who haven't been as close to the FDA don't have that ingoing view. So that's the mission. The FDA has two really important parts of it from, I think, where you sit. The first is the Office of the Commissioner. That's a political office. And they oversee really the strategy, the oversight with Congress and that interaction. They arbitrate sort of the final calls on a handful of things, but seldom get involved in technical reviews. They also, by law, have a program that actually has to help small businesses. So the FDA has a bunch of special tools and offices and helpers to make sure that startups and small businesses understand how to do this and get their applications in and are able to get them through. And the Office of the Commissioner is the point at which those report. The other key office is the Office of Regulatory Affairs. That's sort of where the mechanics happen, the regulation. And they're the ones that really execute the public health mission, and they also have all the inspectors. So if you've been audited by the FDA, if you've had to do compliance, if you've had a plant that's inspected or there's a food outbreak, these are the folks that actually manage that and work through that. They also have all the laboratories, so all the testing and stamping and things of food and things that happens through that office. Most of the workers are on the Office of Regulatory Affairs at the FDA. The FDA, org-wise, has 6 major centers: food safety and applied nutrition, drug evaluation and research, known as CDER, devices and radiological health, biologics evaluation and research, which is CBER, veterinary medicine, and then tobacco. Tobacco is the new one that was formed early in the administration to tobacco regulation. The one that we're going to talk about today, because it's relevant to mobile health, is the devices and radiological health. That's the branch that does devices, and their review process is called the 510K process. And that process, just so you know, is the shorter one, the easier one, relative to the one that the drug evaluation and research group goes through, or the biologic evaluation research group goes through. They're responsible for making sure medical devices are safe, that they work, but mainly that they're safe. So there's a much bigger influence from the device guys on that they don't break inside of you, that they perform the function they're said to say. They aren't asking for complicated trials for the most part about sort of is it better or not. Software falls under their jurisdiction. There's a law called the Medical Device User Fee Act that helps fund them and sets the timelines into law for how the process has to work. It's going to be reauthorized shortly by Congress as part of the big FDA reauthorization bill. But that's the law that has all the mechanics of how they have to respond to you. And so that's sort of the one I'm going to click into now for a second. So they're the ones who just released the mobile health policy, and I want to walk you through from kind of the White House perspective, what were the guiding principles that we asked them to incorporate into the mobile health guidelines. The first one is to support innovation. I think whether you're talking to Todd Park, Anish Chopra, my boss Larry Summers, or myself when we were at the White House, we absolutely believed that we need to ignite the sort of virtuous cycle that comes from innovation in healthcare to create better markets, lower costs, improve labor productivity, reduce unnecessary variation, and that all has to come from technology. It's going to be applied in healthcare like it has in every other part of the economy. And the FDA ought to make sure that when it's affecting direct patient care, it's safe, but that it doesn't get in the way of the fact that we want to have a more dynamic healthcare marketplace. So that's number one. The second one is that the Affordable Care Act has a whole bunch of requirements around changing the delivery system, integrated care, payment reform, that need technology to actually make this thing work. It's the oil that makes it work. So it better support the Affordable Care Act implementation than the HITECH Act, which is the act that gives doctors rebates to get EMRs and meaningfully use them. We realize that an EMR by itself sort of is only an EMR by itself. It needs a lot around it to make it actually affect health outcomes. We want to have a lot of technology created that support that, and also create competition in the EMR space so you don't have enterprise software that costs $1 trillion that you have to buy. Third one is augment the OpenGov and HHS health data initiatives. So a big overarching theme across all of this administration is the notion that we want to have data get liberated. And we want to have innovation come from that data. So we want to support startups that use that data. Want to drive down healthcare costs because we can't afford it to go up at the rate it's been going up. Improve public health. If we don't do something to affect childhood obesity, for instance, and morbidity, no matter how efficient we make the care delivery, we'll need too much care. So we have to improve public health. And then create jobs and GDP. We need 22.5 million jobs to flourish after this recession, and we better get a lot of them in healthcare. So we want to have an innovative environment that creates new jobs and startups like you that get big, that hire a lot of people. And so what's the FDA regulation related to medical devices? I made a pyramid to illustrate that it's only a little bit of what's happening in health IT land and mobile health is going to be regulated. That's really important. There's a good chance that whatever you're doing is not affected by the FDA at all, which is maybe the take-home message you should most take away. All the FDA cares about is mobile medical devices. And I'm going to define them in a second, but suffice it to say, most of what you're doing is not a mobile medical device. There's a handful of stuff in the gray area where there's discretion. And there's a lot of stuff that's mobile apps, which are not medical devices and not subject to FDA regulation. For the top of the pyramid, you have to go through the 510(k) process, the least scary form of FDA regulation. For the next stuff in this pyramid, the stuff that might be a device but probably isn't, you just have to register. So you have to make the FDA, let them know that you exist, write a short bio, shorter than you wrote for Rock Health probably, about what it is. But that's it. If you're not those, go to the App Store and have fun. You don't have to do anything with the FDA. So what is a mobile app or device? This is literally the definition taken from the regulation. And while I'm not a lawyer, this English is fairly straightforward, so I'm going to go ahead and interpret it for you. A device is then used to diagnose or treat a disease. So if the phone takes a picture of my eye and tells me my contact lens prescription, that's diagnosing a disease. If it takes a picture of me and tells me, my heart's beating, that's probably not diagnosing and treating. So, is it actually a test that's used to diagnose, not sort of for elective monitoring, but really for diagnosis? The second thing is it like a remote control for an already regulated medical device? So pacemakers or cardiac defibrillators or implanted things inside of you that need software to run, if this is like changing the software, well then it's going to be regulated with the device. If it's an X-ray viewer for the radiologist to do the diagnosis, it's a remote control for that. It's going to be regulated. So is it an accessory to something already regulated? And the third, does it transform something into a medical device? So does it make the phone somehow treat cancer? Does it make something that's like a Wii actually like do a laparotomy? Like if it makes, which would be really cool, but does it make something into a medical device? Very few instances will this be the case. X-ray viewer is the best example of this, where it makes the phone into a viewer. And so in that case, when you're zooming, for instance, you have to make sure that the ratios stay right, so the measurements are right, because it's very important for an X-ray, if you're measuring a tumor, to, when you blow it up on your iPad, like to actually have the ruler still work. And so That's the kind of things that they're going to look for. But if it doesn't literally meet these three things, it's not a medical device. And I can tell you, as a venture capitalist who's had the chance to meet some of you and see a lot of people who are inventing cool things, 99% of what I'm seeing is not meeting this definition. So most things are not going to be regulated. And if they are, they're regulated by the FDA 510K process, which is way less scary than the NDA process. So probably not regulated. If it is, no worries. It's actually the easy one. So the FDA, the 510K process is simpler, has a much shorter timeline, much lower cost, both the fee but also like the work to put it together. It's far more likely to come to a favorable outcome. Most things sort of that are not nuts get through the FDA 510K process without a whole lot of gymnastics. Like, it's one that you get through. The third thing is, I was flabbergasted when I talked to folks at the FDA about, so what's the deal? People think that you guys are crazy and bureaucratic and slow and they don't like you. What's wrong? They said, actually, it's shocking how many people who send their submissions and literally have them be incomplete. So they say it takes a long time, but they're missing like half the forms and they forgot to sign the dotted lines, and it's not done yet. Most of the delays in the device world appear to be actually driven by not having it done. And so that's the lesson number one, is have the like your college applications, like get them done correctly, like all the forms, send them in the same envelope, like do it right. Most of them aren't, literally. The second one is read the guidance. The FDA, it's a heroic act for the FDA to issue stuff in the public domain. It has to go through lots of lawyers and lots of review, but it's all there for a reason, to help guide people to know what to expect. So read the guidance. The FDA website is a treasure trove. I wish it were designed by you, but despite its lack of consumer ease, it has a wealth of really good stuff on it for how the process works, who to call, and like phone numbers of people that actually answer the phone, like in their name, email addresses, guidance for how to fill this stuff out, examples of what to do. It's really meant to be user-friendly, paradoxically, despite its layout. And so, look at what's publicly available. The third thing is, have a lawyer who knows something take a look at it if you're in doubt. So it's probably penny wise to actually have a lawyer review before you go to make sure everything's complete and that you aren't doing sort of the common pitfall sort of mistakes. And there's lawyers who do that better than others, so get one that actually knows about the FDA. It's not sort of an assumed skill of any lawyer. And if you kind of keep these three things in mind, I would be very optimistic that the process will go well.